Do you suffer with knee pain? I'm here to tell you that there's a way that may be able to help you. Hi, I'm Dr. Jason Tripp. I'm a chiropractor and a naturopath right here in Hermitage. And we use a very specific technology that combines laser and knee decompression to help heal knee issues. And so I want to tell you about a young lady. She came to see me. I say young lady. She was actually 83 years old, and she had what was near bone on bone. That's literally, when you saw, most medical doctors would look at it and go, yeah, it's just bone on bone, it's bad. It was really bad. And it was close like this. She's 83 years old. You can imagine what her knees look like. So we decided that we'd give it a shot. She really didn't want to do the surgery, and being 83, she wasn't sure about the safety of that surgery. And so I did the surgery did the care for her, and at the end of her care, where she was near bone on bone, had actually opened by almost double. We have the x-rays, we have permission to be able to show them to you. So if you have a knee problem or a knee pain, I encourage you to come down and I'll show you the x-rays. I'll show you the before and the after, and you can literally see from small, almost bone on bone knee to close to normal knee. I thought it was a pretty amazing result. I wanted to share that with you today. So many people are suffering with knee pain and they don't know what to do. What we do for you is we actually look and see what's causing the problem. A lot of times people don't know what caused it, or if they do know what caused it, was a car accident, a fall, sports injury, those kind of things. They don't know what to do about it. Well, what you do whenever you have an injury is your body will go through 3 phases of healing. It'll go through inflammation phase, where it tries to decrease inflammation. And your body's working on it. The repair phase is when your body is putting in scar tissue to heal the area. Scar tissue is the healing tissue. The problem is it has 4 negative effects. It makes the nerves more sensitive, which means they feel pain faster, so your knee would hurt more. The nerve gets tangled inside of the scar tissue, and when it does, it's easier to cause pain when you move. The scar tissue is weaker and it's less mobile than normal tissue. So somebody who heals wrong will actually have permanent damage because they healed wrong. That's what leads to arthritis, which is one of the #1 causes of disability in our country right now. So we don't want to let this go into an arthritic thing that can be painful for the rest of your life. But if it heals wrong, it will go into that, where you have some pain to some degree the rest of your life. In other words, if I bend just like this, normally that wouldn't cause pain. You might bend like that and it caused pain for you, and then you're in pain for a few days. Then you have a day or two out of pain. You twist just barely going up the stairs, something like that. Then it's going to cause pain again. So we want to not have that. And each phase, there's actually certain therapies you should be doing. In the inflammation phase, it's all about stopping the pain. When you have a fresh injury, you want to stop the pain. You do everything you can with that. And there's a bunch of therapies we do in office to help you with the pain to get that down. The real healing takes place in repair phase. In repair phase, you're decreasing nerve sensitivity using electric muscle stim. Electric muscle stimulation is a mild current that feels like a gentle massage to your knee. However, it decreases the nerve sensitivity, so it's less likely you're going to feel pain from that knee. The nerve entanglement is when the scar tissue is being set in, it wraps around the nerves. When it does, and you move, it makes them hurt. So to decrease the nerve entanglement, we use the chiropractic adjustment to align the joint and align the fibers of the scar tissue. Just like if you throw a mop on the ground and everything lands all crooked with the mop fibers, but you can take the mop and twist it and it'll straighten out that mop. Well, it's the same way in your knee. The nerves get tangled, and when we make that adjustment, we can straighten out the fibers. That does 2 things, but that'll decrease the nerve entanglement and decrease the chance you're going to have pain when you move your knees, when you bend or twist or turn. So that'll help to heal through that repair phase. Once you're done putting in scar tissue, there's no more being secreted. Then you go into what's called remodel phase, and that's where you want to get strong. You want to make those knees strong so that they can last and be strong for a long time. The #1 mistake people make is they'll stop care after they get out of pain. They won't try to go through the healing process. But frankly, it's just because we don't know. It's not even your fault. You didn't know what the 3 phases were. Nobody told you the 3 phases. But if it heals wrong in the 3 phases, I think you can see that that's going to lead to a permanency. So what we do in our exam is we find out which phase you're in, what care can be done to prevent any permanency, or reverse this totally if we can, but really it's a matter of how much will your body allow. Is there a little bit of permanency? Is there a lot? Is it all too late and there's nothing that can be done? In that case, we'd refer you to a proper specialist to seek a surgical consultation. But I think most people would rather not have to have surgery. So if there's a natural method to do it, that's where we come in. And what I do is we have great results, like the lady that I was just telling you about, and she was 83 years old, turned 84, had a birthday, and she went from terrible degeneration to where her knee actually had height in it again. Actually, meniscus came back. Pretty amazing stuff to see. And if she had more than 85% damage, I wouldn't have been able to do anything. But she had less than 85% damage, so it worked, and she got great results. So because of that, we've decided to put together a new patient special for people with knee pain. If you have knee pain and you want to come down, our $47 new patient special includes a consultation with me to make sure that you're a candidate for what we do. The second portion of it is to make sure that that your body is not too far gone. In other words, that it's not too late. If you have less than 85% damage, likely I can help you as long as the nerves aren't too far gone. If it's more than 85% damage, likely not much I can do. So the test will tell me, can you be helped or not? Second thing is we look at the bone, and so we take an x-ray of the bony tissue to see how far gone it is, and if it's too far gone, I'll let you know. But even if it's close, this young lady, she was 83, most doctors would have said, yeah, you need surgery and there's no other option. And yet we got her results. She did better, we opened up the joint space, and she did amazing. So I'm going to encourage you to come down and just get a second opinion. Find out what can be done for you, for your knee pain, to get you back on the right track, to get your life back, to be able to play with the kids and the grandkids, to be able to get out and walk. Whatever it is that you enjoy doing, that's what we want. It's a quality of life issue. You don't want to be stuck on a couch somewhere because you can't get up and move with your knees. So give the office a call at 724-342-2225. That's 724-342-2225. Tell them you want the new patient, $47 new patient special, the knee pain severity exam. That's what you're going to get. Call the office now. I'll talk to you soon.